Hello beautiful people, I'm Dr. Ahmed and we're back again with another video. Today guys, it's going to be all about filler dissolving. Whilst we're here, give us a little thumbs up, subscribe, and if you've got a question, drop it in the comments below. For certain individuals that have either had bad filler, it's migrated, or it just does not look right, you might be thinking about getting it dissolved. And this is why I'm going to be answering all your questions about it today. Filler dissolving essentially uses hyaluronidase, which is a synthetic enzyme that breaks down filler. So dermal fillers are made from hyaluronic acid, and the hyaluronidase is essentially the antidote to that. So it breaks the bonds in between the molecules and you just excrete it. Before you get your filler dissolved, you need to be patch tested. And that's because a certain percentage of people could be allergic to this. And the severity of the allergy could be all the way up to anaphylaxis, which is life-threatening. And this is why we patch test a bit of the dissolving agent in your forearm. And over a 24-hour period, we observe for any reactions. A bit of swelling, a bit of bruising is normal. However, red, angry-looking skin after isn't. With hyaluronidase, it comes in powder and then we reconstitute it with a bit of saline to make it into a solution. The concentration of that would really depend if it's a normal situation, you just want to get your filler dissolved, or if it's an emergency. An emergency could be things like injecting into a blood vessel and you notice that actually the skin is becoming a bit mottled, or there are signs that, this is not right. This usually happens then and there in your initial appointment when you're getting the treatment. In the UK, hyaluronidase is actually prescription-only medication, which means that it's usually given by prescribers like doctors, dentists, and prescribing nurses. There have been situations in the past where people have gone to non-medics to get filler treatment and they actually needed to get it dissolved. And that injector didn't have the training to be able to do that. And sadly, in these situations, the complications could be very severe and they can be anywhere between losing a bit of skin to losing vision. With the dissolving agent, if it's being used for cosmetic work, i.e. you've had a bit of dermal filler somewhere and it just doesn't look right, you essentially get the solution injected where the filler was initially and you see some results more or less instantly. I always tell my patient it's like a bit of Pac-Man. So it just starts eating away at the filler then and there, but you see the final results usually at that 1 week mark. And this is why I always say, if you want to repeat the treatment, i.e. you've had some filler, you've got it dissolved, but then you want to refill the area, wait about 2 weeks or so. Post-treatment, swelling is quite common. Getting a bit of swelling does not mean you're allergic to hyaluronidase. In fact, it means it's kind of working really, because a bit of swelling is our immune system kicking in. So swelling, potentially a little bit of irritation to the skin, a bruise, that's all normal. To be completely honest with you guys, I'm not the biggest fan of dissolving filler, because you always need to think of the pros and the cons. And sometimes waiting it out and waiting for the filler to just dissolve naturally might be worth it really. That's because the dissolving agent holds the slight risk of dissolving your own collagen, which means that the skin in itself might get a little bit thinner with time. This complication might not be apparent then and there, but in later life, you might notice that that bit of skin that got dissolved is a little bit thinner. Thank you so much for watching guys. Please give us a thumbs up, subscribe, and drop us a little comment if you've got any notes or any questions.